Have you been feeling nauseous, burping, or consistently having burning sensations around your chest? If you happen to be experiencing these symptoms for a very long time, then it is likely you are suffering from a condition called gastroesophageal reflux disease. Gastroesophageal reflux disease is what we acronymize as something we call GERD or GERD, depending on how you pronounce it. The word gastro is something related to the stomach, and esophageal, we are talking about the esophagus. The word reflux means backward movement, and disease, as you know, anything that is against the normal way the body functions. So gastroesophageal reflux disease is a condition where there is a reflux of acid within the stomach back to the esophagus. In a normal process, food should rather move right from the stomach to the duodenum rather than moving backwards into the esophagus to cause burning sensations within the chest. To understand better, let's refer to the image. Let's look at the image right on the screen. Right when you ingest food, the food has to pass through the esophagus and move downward. It reaches a point called the lower esophageal sphincter, which closes and opens to allow the passage of food into the stomach. Be reminded that the stomach also produces a fluid called hydrochloric acid, that is the HCl, that helps in digestion. This acid mixes up with the food in the stomach, making the contents within the stomach very acidic. And whenever there is a reflux, it causes a burning sensation in the esophagus that is termed as gastric esophageal reflux disease. These are factors that do contribute to you having gastroesophageal reflux disease. The first point is lying right after eating, coughing and vomiting are also factors that do contribute to you having GERD. Anytime you cough or vomit, the diaphragm directly impacts the stomach by letting it push its contents out of it right into the esophagus. And because the stomach content is already acidic, it causes a burning sensation within the esophagus that makes you feel that burning sensation. If anything makes you feel nauseous, leading to vomiting, try to stay away from it or consult your doctor to prescribe the right antiemetic for you to resolve that vomiting.
God help me not that day.
If you have been coughing due to a certain condition, it is advisable that you take your drug to help stop that coughing. There are also some drugs that can help treat GERD if you are suffering from any. We have the proton pump inhibitors, that is the PPIs. We have the esomeprazole, omeprazole, lansoprazole. Now another class of drug is called the histamine 2 receptor blockers. The example is the ranitidine and the famotidine. These drugs purposely stop the production of acid within the stomach lining. If there is no production of acid, then probably there wouldn't be any irritation should in case there's a reflux of stomach content into the esophagus. If you are suffering from GERD, you are free to go and you take these drugs rightly.